Prostate cancer is when normal cells become abnormal and they grow at a much faster rate. Initially, the growth occurs within the prostate, and then over time, the cancer extends outside of the prostate, and it also can spread to other parts of the body. 1 in 44 men are expected to die from prostate cancer sometime in their lifetime. The key is catching prostate cancer early. If we catch prostate cancer in the early stages of the disease, prostate cancer is curable. Now, there are a number of reasons that have been proposed to account for the high incidence or likelihood of developing prostate cancer for African American men, as well as the likelihood of dying from prostate cancer. One, oftentimes prostate cancer is detected at a later stage in us. Secondly, for some reason, prostate cancer in African American men is more aggressive. The growth rate is much faster. We often have poor surgical outcomes. By the time that we get to surgery, oftentimes cancer is already spread outside of the prostate gland. And for these reasons, cancer death rate for us, prostate cancer, is much higher. Well, the risk for prostate cancer includes age. As we grow older, our chances of developing prostate cancer increases. Race, I mentioned, African American men have the highest chances of developing prostate cancer in the world. And family history. If you have a family history of prostate cancer, your chances of developing prostate cancer increases. First degree relative, that's your brother, your father, your son. If they have prostate cancer, then your chances of having prostate cancer increases. Okay? The more first degree relatives you have with prostate cancer, the greater your chances of developing prostate cancer as well. There are some myths associated with prostate cancer as well. And that is, if I have no symptoms, then I don't have prostate cancer. That's a major myth. Unfortunately, the most common symptom for prostate cancer is absolutely no symptom at all. Okay? Now, as prostate cancer develops, then men can begin to experience symptoms. Weak flow, waking up at night, painful urination, blood in the urine, blood in the ejaculate, bone pain. Those are some symptoms of an enlarged prostate, but they also can be symptoms of prostate cancer as well. And if a person has bone pain, usually that's a sign that the cancer has spread to the bone. 2 very easy tests to detect prostate cancer. One, the blood test, which is called PSA. And PSA means prostate-specific antigen. And the other test is the digital rectal examination. Now, oftentimes guys ask me, do we still need the rectal exam? Well, the recommendations have changed now. We used to just recommend one thing. Most people who are assertive in detecting prostate cancer, particularly in African American men, will say if that PSA value is 2.5 or greater, then you need to be evaluated. Now, if the PSA rapidly rises, that's a sign that cancer may be present. But if there's a slow, continuous, progressive rise, usually that's a sign that the prostate just may be increasing in size and may be dealing with an enlarged prostate versus prostate cancer. Regardless, if that value extends beyond 2.5, you need to get it checked. American men are much more likely to die from prostate cancer than any other ethnic group in the world. Oftentimes, prostate cancer is detected at a later stage in us. Secondly, for some reason, prostate cancer in African American men is more aggressive. The growth rate is much faster. We often have poor surgical outcomes. By the time that we get to surgery, oftentimes cancer is already spread outside of the prostate gland. And for these reasons, cancer death rate for us, prostate cancer, is much higher. The goal of surgery is to get you back to where you are now without cancer. And a lot of guys are concerned about their sexual health, but in reality, by the time that a person gets prostate cancer, in many instances, not all, but in many instances, by the time that a person gets prostate cancer, they're not having very much sex anyway. So it's really not that big of an option. But the nerves that are involved with getting an erection run right alongside of the prostate. And a good surgeon can identify those nerves, push those nerves aside, remove the prostate, and preserve your sexual health. First line of treatment are usually medication. There are at least five different oral options out there. Viagra, Cialis, Levitra, Staxin, and Stinger. All of those are options to, oral options to achieve an erection. At some point, those options no longer are effective. Then we move to the second line of treatment. The second line of treatment could include a vacuum erection device, which is a little cylinder. You place your penis in this cylinder, press a button, it creates a vacuum. The vacuum draws blood into the penis and releases a constriction band. The constriction band keeps the blood in the penis, allows you to engage in intercourse, and when you finish, you remove the band and the erection goes away. There's also a suppository, a little urethral suppository that you can insert into the urethra, rub it in, it gets absorbed into the urethra, it increases blood flow into the penis, and that leads to an erection. Another option is an injection, where you inject your penis with medication, and within 5 to 10 minutes, the phallus of the penis gets erect, you use it, then it goes away. Then there's an inflatable penile prosthesis, whereby 2 cylinders are placed into the penis that are attached to a reservoir that goes behind the bone and a pump that goes into the scrotum. So whenever you get ready to have sex, you just press on the pump in the scrotum. It allows fluid to go from the reservoir into the cylinders, creates a hard erection. You can use it as long as you want to. When you finish, you just press on the button and the erection goes away. Apple vinegar increases the free oxygen radicals throughout your body, particularly in the prostate. That helps to control the inflammation within the prostate, helps to keep the PSA down, and also it may also prevent prostate cancer aggressiveness. So you can take apple cider vinegar gummies, or you can take the fluid. If you take the fluid, I would recommend mixing it with something like beet juice, because beet juice also helps to increase the oxygenation in the prostate gland.
In what quantity you can take that? That's what
Each one, read the instructions. Each bottle has a different recommendation. Some recommend 2 gummies daily. Some recommend up to 6. The fluid, an ounce a day.